Hello and welcome to Radiation Residency with Dr. Purnima. So today we are going to discuss regarding something very important and very relevant to all those who have come new to the branch. First of all, congratulations for getting such a wonderful branch in your PG, and we welcome you to the family of radiation oncologists. So if you are a first year student who has recently joined your institute as a MD or DNB student, then the first question that comes to mind is, ma'am, what should we prepare? How should we go ahead? And what to do. So first, take a deep breath. So inhale, exhale, okay, and take things slowly. Don't rush into anything in the at least first 1 to 2 months of your residency. Don't try to rush into patient treatment. Don't try to rush into reading textbooks. Don't try to rush into anything. Just give yourself time to settle in a new place, because you have come out of your comfort zone. You have come to a new place after you've done your MBBS, and now getting into PG residency can be very overwhelming, and it can take your toll physically as well as mentally on your health. So therefore, I just want you to settle in the department. So first, for the first 1 month, just try to understand what the department is doing, what this branch consists of. How do we see patients in the OPD? What do we counsel? What we ask? How do we take the history? And how do we proceed further? How do we give the diagnosis to the patient, how to send samples, how to get the CT, MRI or PET done in your own institute. So this is what you have to figure out as a first year. And if you have indoor ward, then you have to know how to look after the patient, how to admit the patient, how to discharge the patient, because this responsibility would come upon you. So first, just try to understand the logistics of the department. Try to understand how the other consultants, how your seniors, your colleagues are. So if you have colleagues, then make sure you have a good bonding with them in the first few months, because they are also new to the department. They are also learning things. So make sure you have a good friendship between yourselves, so that you can divide the work and work efficiently for the next 3 years. Secondly, make good relations with your seniors. Be a trustworthy resident, because this is very important when you do your residency, that your senior should be able to trust you with some work. So just be honest with, if you understand something, you don't understand something, be clear and don't try to make any mistakes or blunders just because you are trying to not talk to the senior or not want to show that you are not understanding things. So second most important point is get well versed with your seniors. And thirdly, try to understand your consultants, because each and every consultant will have his own way of working, his own way of wanting things. So try to fit into the department, try to get into the workflow. Don't try to make anything up by yourself, because this is a new branch, you don't know anything about it. So as a newcomer, ask as many questions as you want, but don't make any blunders in at least your first 2 to 3 months of your residency, and then eventually you'll get hold of it. Now this is the general etiquettes or the general things about the oncology residency, but now we come to the preparation and the studies part. So just after 2 or 3 days of joining, I get messages, ma'am, I've joined, but I want to do DM Medonco, or I want to do FRCR, or I want to go for some other exam. So what should I do? So what I would suggest is, keep these thoughts on a low-key mode right now. Just try to understand the subject. Give it 1 year. So complete your first year of residency, and after that you will have a good idea of what you want out of this. If you want to continue with radiation, being a radiation oncologist per se, then you can study according to it. You can go for MD, DNB, or you can also think of settling abroad. So you can study for FRCR then. But if you want to go for DM Medonc, then you have to study more regarding the chemotherapy. You have to be more interested in knowing the pharmacokinetics, dynamics, side effects, and their the composition mechanism of action. So you have to direct your study according to that. So for the first year, I would want you to just focus on learning the basics of radiation oncology itself. And after 1 year, if you start enjoying this subject, I would urge you to continue in this. But still, if you want to go into DM Medonc, second year is when you actually get some understanding and some insight into what you like and what you would you'd want your future to look like. So don't rush into anything, don't rush into any preparation. But yes, first year is the time where you build yourself up as a resident. You get to know how to manage time, how to do things, how to do the OPD ward work and also take out some time for yourself to study. So for that, as you know, that we have our Radonc residency app. So it is a very easy solution, because if you're sitting in wards, you have your night duty, you're very tired, you don't want to study from the big textbooks that you have, you just put your headphones on and listen to the lecture. The lectures are around 30 to 35 minutes each. So it will be very helpful for you to get to know the topics, to get to know the advances, to get to know the radiation techniques. And for the first year, I would want that you don't go into the fancy stuff, just stick to the basics of radiation biology and radiation physics. So this is the base of your radiation oncology, and this is going to help you in every further thing that you do. So make sure, if you don't have anything in your mind, you don't have time, you have 15 minutes when you have your lunch, if you have 15 minutes when you have your dinner, just listen to any one lecture. That will actually get you a good heads up and a head start when you start studying in your second and third year, because most of your concepts would be clear by then. And then, how to pair the app with your textbook. So many of you have this query that, ma'am, if we only study in the app, if you only watch the videos, do we not want to read the textbooks, or is it a replacement? It is not a replacement. Nothing can replace your standard textbooks. Okay, so this is a supplementary material to make and summarize all of the things that are given in your textbook. So it is not humanly possible for me to put down each and every word of Perez or each and every word of Eric J. Hall or Khan into these videos. These are the summarized videos which will help you grasp the concept easier and write it in your exam. But I will always suggest you that you listen to the video first. So suppose you are trying to study about radio sensitivity and cell aging. So I want you to watch the video so that you get the knowledge that what are we talking about, what is it all about, and then go to your textbook and read. You will require less than half of your time what you require when you first go to the textbook, because it is very, very difficult to comprehend from so many examples, so many clinical trials, so many justifications that they have given. We actually don't understand what point they are trying to tell you. So that is what I've done in the video. So this is how this will complement your studies with your textbooks and your videos. And you have to make a balance and make sure you make some time out every single day, because this is not something that you will just study in the last 4 or 5 months, because there is a lot of content. We have more than 200 videos which we have already uploaded. So if you feel I will subscribe at the end of my third year or in my third year, so then you will not have time to listen to the videos, make your notes and study it. So first year and second year is the time for your concept building and note making. So make your notes in first and second year itself. In first year, do radiation biology and radiation physics, and second year, go for clinical oncology, go for brachytherapy, go for radiation techniques. So these are the subjects that you build upon eventually, and of course your chemotherapy and targeted therapy as well. And in third year, you have to revise everything. Okay, so this is how you space your studies. You give yourself time, you try to make a balance between your work and your academics, and don't try to rush into anything. Don't try to finish one single topic in one day. Give it a week, because you have time. You have 3 years to do it. So don't try to rush into it because the video is of half an hour, 30 minutes. You would want to study it and complete it in one day. No, not required. Because if the video is of 35 to 40 minutes, if you try to make down the notes, it will take at least 2 to 3 hours for you to pause it, take down notes, understand it, and then proceed forward. So take your time, don't rush. Just don't get overwhelmed by a lot of course, because yes, there is a lot of course, but it can be done. It is doable. Your seniors have done it, and you will also be able to do it. I have done it, you can do it, and everybody does it. So it is not an impossible task. And at first you might not understand a few techniques, or you might not understand a few terms that the seniors are talking about. So don't hesitate to ask. If you want our help, we definitely can help you. Just put down in the comments below if you need any help in the videos, or we have our WhatsApp number on the app. You can directly contact on the WhatsApp number, and I will personally help you out in this journey. So this is how you can plan your residency in a way that it will be fun, easy, and it will just flow like water, and you will not understand how you finished it, and you will be very well prepared for your exams at the end of it. And you can also choose your career path if you want to go for something like DM Medonc or FRCR or any overseas exam. So with this is a wrap up for this video. I hope that I have been able to solve most of your queries and doubts that you have in your first year. But if you need anything else, please write down in the comments below. We'll make sure that we make the videos. And check out the Radonc Residency app if you haven't. We have a lot of videos which are demo and free videos. You can just see how it goes and how it works. And if you like it, then do make time and subscribe and let us know how you like it. So all the very best, and I'll see you in the next video.